Hello, this is Chelsea Marks, and I'm filming for VETT 221, Task 16, which is sterilize and clean some surgical instruments. So I have a variety of surgical instruments here that I'm going to clean. And I want to make sure you see on the wall here our OCCI certificate. There it is, prominently displayed. Alright, so we're going to get down to explaining how we scrub our instruments here at Evergreen Veterinary Hospital. So, first thing we would do is we would take these soiled instruments from the surgery suite. We would go ahead and rinse them under cold water if they're soiled with blood or anything like that. And now that they've been rinsed and they're not visibly contaminated, we're going to go ahead and pre-soak them. The solution we use for our detergent is a 2% chlorhexidine gluconate solution, and we just go ahead and pour a little bit of that in there. I'll show you this here. 2% chlorhexidine. Perfect. So that is going to be our pre-soak. So that is just warm water and the chlorhexidine. So wearing my appropriate PPE, I have goggles on, a mask, and some gloves. You can barely see them because they're skin colored, but they're there. We want to be careful, not splash this in our eyes, get it on our skin, and it is a little bit smelly, so we want to make sure we don't get it in our lungs as well. So first thing we do is grab our scrub brush. We use a little children's toothbrush here so we can fit inside these tiny little serrations that every instrument has here. So tiny little serrations going back and forth. We want to go ahead and scrub those with the serrations back and forth, opening up all the box locks, making sure everything is clean, making sure everything is in working order. I'm going to go ahead and clean that. We also use an ultrasonic unit here, so we go ahead and put them in there for the next step. So again, scrubbing with the serrations, opening up the box locks and getting down inside. So that one looks good. And into the ultrasonic. So I'm going to do the same thing for all of them, making sure that they're functioning, making sure that they're free of debris, that we're scrubbing every portion before we go into the ultrasonic. So again with the scissors. And with our curved Kellys. With the serrations, because Kellys have serrations, and our needle holders as well. Down inside, and our mosquito forceps. Another pair of those with the serrations. Getting up into the handles as well. Scrubbing our towel clamps. And we're really careful with these because you can get poked pretty badly with our type of towel clamp, which is a Backhouse towel clamp. So we have those in there. A couple spay hooks here. So this was a feline spay pack. So it might be smaller than some clinics' packs, but we have 10 instruments. 8 ringed instruments, and then an atraumatic forcep here, thumb forcep that we have scrubbed really good, paying attention to that tiny little serration and that groove in the middle. And another set of atraumatic forceps, scrubbing the handles as well as that serration. And then one more mosquito hemostat. Getting the ring portion and in the lock, and rinsing that off. So now we're done with this solution, so we dump that down the sink. Okay. And we're done with our little toothbrush too, so we're going to put that back. So for 5 minutes, we go ahead and ultrasonically clean these instruments as well to remove any extra debris. We'll put that for 5 minutes, and we will come back. Okay, so our instruments have just finished their 5 minutes in the ultrasonic cleaner. We're going to head and take the basket out. Let it drain a little bit of that excess liquid out. And then we're going to rinse with water. So taking out each instrument and rinsing them. Okay. And placing on a clean, dry towel here. And rinsing some more. And I'm opening up every instrument just to be sure that they're really well rinsed. Okay, so now we have them on this clean, dry towel here. We're going to put that back because we've done with it. So we have our instruments out on this clean, dry towel. What we're going to do next is the instrument lubricant or instrument milk. So what we have here is our pre-mixed solution, and I want to draw attention to the bottle here that it says Henry Schein Instrument Lubricant. And we mix our lubricant, 1 part lubricant to 2 parts distilled water. We don't use full strength. I don't think anyone probably does use full strength instrument lubricant. It's very greasy and it is not good for the instruments. So we use 1 part lubricant, 2 part distilled water, and that's what we have here. And I want to note that it was just changed here on 5/19/17, and as well as it's in a secondary container, so the appropriate OSHA SDS label is applied. So we have our milk ready. So instruments sit in the milk, and we go ahead and open them up and close them. This lubricant is to help keep them running freely, smoothly, and also it has a rust inhibitor. So we're going to head and be sure we get those nice and lubricated. The thumb forceps don't necessarily need the lubricant, but they do need the rust inhibitor, so they're going in as well. And we're going to put the towel clamps in there and the last 2 instruments. So now that those have been in there and swished around, we're going to take them back out on this clean, dry towel here. And everything is out of there, so I'm going to remove this from the area. And move the camera down just a bit so you can see. So these instruments are laid out and allowed to air dry. We can also pat them dry, so I'm going to go ahead and do that. So we have them laid out neatly here. And move this over. So with our towel that's clean and dry, we're just going to pat down the instruments and make sure that they are all dry as well. Okay, everything seems to be in good working order and also dry. So it looks like we've done a good job. So that was VETT 221, task 16.